Very welcome from Munich, Germany. My name is Susanne Lauer, and together with Dr. McClement from Eppington Park Vet Referrals in the UK, we would like to share some of our thoughts about the role of physical therapy in canine osteoarthritis management. Throughout this presentation, we would like to touch on the importance of physiotherapy. We would like to introduce you to something what we name the physiotherapy pyramid. And finally, we would like to provide some practical, down-to-earth recommendations that can be utilized in practice on our osteoarthritis patients. So today, the terms physiotherapy, often we also say physical therapy, refer to the diagnosis and treatment of diseases and injuries and disabilities that jeopardize normal movement and physiologic function. In human medicine, physical therapy has been considered since many centuries an important adjunct or even alternative treatment approach for osteoarthritis. On the veterinary side, we're a little bit behind, but we've caught up the last 30 years. Why is physical therapy so interesting for us? Because we can improve the response of our patients to medications, and we can certainly increase the quality of life. There's a multitude of physiotherapeutic exercises, modalities like laser, shockwave therapy, and simple assisted devices down to cutting-edge orthoses that can be employed to restore, to maintain, or to maximize physical strength and function. There are three principal goals that we have for our osteoarthritis patients. Number one, surely we want to reduce pain. We want to minimize the muscle loss, improve the muscle atrophy that we see through disuse in our patients, and we want to maintain the very important joint function. Certainly, physiotherapy is not like cookbooking. Every patient is different, and we have to keep the health and fitness of the patient in mind, in which environment the patient lives, what's the exercise, the lifestyle of the patient, but also of the caretaker at home, of the whole family. Which kind of active therapies can we employ? Some dogs are very good on a treadmill, whether it's aquatic or terrestrial. Others are just scared and we can't use it. We also have to consider comorbidities, like on the human side. We have a big problem with obesity, but also with cardiac disorders. And we see similar themes on our side. So what's up with this physiotherapy pyramid? I assume very similarly to Jamie and me, you come from a busy clinical environment, and osteoarthritis is a very complex disease. And we ask ourselves, where do we start? There are so many things to talk about. What should we prioritize? And it is sometimes easy to get a bit lost. And that's where this physiotherapy pyramid comes into play. So it provides us with a systematic, organized strategy where we prioritize very simple measures as, for example, environmental modifications that sort of provide basis for this global approach for osteoarthritis management that we would like to employ successfully in our patients. At the same time, it's important for our clients that our treatments are cost effective. We have to consider the time, the availability of the client, practicality, and that's how this pyramid is built up. So you just start out at the base, and then you work your way up. And by working up and introducing things from environmental modifications over exercise plan to osteoarthritis specific home exercises. On the top of the pyramid, so you see the treatment by the physiotherapist. In this way, we optimize our physical therapy strategy approach to the patient. Now I hand over to Jamie.
Hi, everyone. So environmental modifications are a really important part of management of osteoarthritis, and it's something that we often overlook as clinicians. But we've got to remember that the home environment is where our patients spend most of their time, and what we see in the clinic isn't always reflective of what the actual truth of the condition is. With osteoarthritis, there are several factors that affect an animal's movement in their home environment. Some of the first clinical signs that we'll see are minor changes in proprioception, as well as muscle weakness and joint pain. Now, those combine to make an animal less able to move around in their home environment. And as they continue to move in the environment, they can get further pain and they can get loss of confidence due to their proprioceptive deficits causing them to slip. And this can then contribute to them moving less. So you get this vicious circle where the muscle disuse and the pain and the proprioceptive deficits limit their ability to move, and the lack of movement then makes the problem worse. Now, what we need to do is intervene to try and stop this cycle. So obviously, if we have an animal with proprioceptive deficits and muscle pain, slipping over on wooden floors or tiles really is not pleasant for them. It will cause them pain, and it will cause them a lack of confidence in use of their own environment, which can upset them and stress them. We also have to consider how they get up from rest, how they are comfortable when they lie down to sleep, because often with osteoarthritis, we're seeing an interruption of sleep patterns. So by making alterations to their home environment, we can often make a big difference to the way that the treatment of the whole syndrome works. So we are trying to make them able to express their normal behavior in a confident and as little pain as possible. Assessing the home environment is not something that as clinicians we're great at. We concentrate mostly on pharmaceutical and surgical interventions. And obviously we see these animals in our environment in the clinic. And we know that from what the owners tell us, this is not often very representative of how they are. Clearly, doing a home visit to the house of every patient that we see is not always very feasible. But one of the great improvements that we've had in the treatment of arthritis is the ability for our clients to show us videos of their patients at exercise or at home. And this will give us an idea of what kind of environment the patient is in and how they're coping with it. So we're not just talking about video conferencing, which obviously we've all got a bit more used to in the last year, but actually just bringing in videos. This is what the patient is like when they're getting up from rest. This is what the patient is like when they're trying to eat. And this will give us a much better idea very effectively of how the animal is in their environment and if there are any changes that we need to implement. So assessing the patient in their gait, in their ability to maneuver around their environment, and also whether they seem to be struggling or having any anxiety relating to that. And we can go for easy benefits here. This is not something that is too complicated. This is something that the owner can do in their own house, and you will see the benefit, and it will improve the effectiveness of your other treatments. So it is important that this is something that often is just missed, and people are just not aware of it. So by raising the owner's awareness, they can suddenly see how they can make a big improvement. And this also helps bond your client into the whole process of managing the pet. I think one of the first things that we can look at is flooring. We've all seen animals that slip when they try and get up and slip when they try and walk. And also often our pets are fed in the kitchens. So tiled floors, they will often have to stand on when they're eating. So working out a way that they can rise and eat comfortably is very important. Obviously, it's a big imposition to ask somebody to remove all their luxury wooden flooring. So things like traction mats, rubber matting are very useful. An animal's going to be reluctant to eat if it hurts and they fall over. So making sure they've got somewhere either rubber matting on the floors or they're eating on an area of carpet is very important to them. Going up and down, especially steps, is harder for animals who've got joint pain. So trying to limit the amount of steps that are involved is very important. So we can do this by using ramps to get in and out of cars, or to go up and down steps in and out of a room or in and out of the garden. But also we have to think of animals that are on multi-floor residences. So we can either block them away from the stairs, and we can do that with stair gates or by training them. But sometimes this is not feasible if the animal, for example, lives in an apartment or a 3-story house. Or you do get some animals that, if they're not allowed upstairs, feel that they're somehow being punished, and then it gives them anxiety. So in those cases, assisting the animal either by using slings or manually can really help them get up and down. And it's an awareness that coming down hard staircases is very difficult, for example, for a dog with elbow pain. The same for getting on and off beds and furniture. Sometimes you have to make a little set of steps. Sleeping surfaces are very important. We know that one of the things that osteoarthritis does and chronic pain does is to interrupt sleep patterns. And this contributes to a general depression in the animal. So sleeping surfaces need to be warm because cold will exacerbate the situation. They need to be firm enough that the animal will not trip or slip on rising, because again, this will cause pain and a lack of confidence. So orthopedic beds are very, very useful. And again, raising the owner's awareness so they know what to look for and what to think of. If you just ask them to put themselves in the place of the animal, and they can then work out what it is that their pet might have trouble with. This is also important if we're talking about cats, because often cats who live indoors will have litter trays that are not easily accessible. So that's something to consider. Excessive changes in temperature are important. Obviously, animals with joint pain don't want to be kept in a cold environment. So animals often will need to be moved indoors if they live outside, and the areas they sleep in do need to be warm. And food and water, as well as being on a non-slip surface, it is important to consider how high and how accessible the food and water is. So talking this through with the owner of the animal is a very important step. It's funny that it kind of seems obvious once you've discussed it, but until you raise their awareness, they don't think of this.
Okay, after environmental modifications, as Jamie illustrated, another very simple measure is to work on the exercise plan of the animal. Similar to what we know from human medicine, it's very important that we avoid to have a sedentary lifestyle. And many of our pets, they do the same thing what we do. We're working throughout the week, and on the weekend, we have our weekend warriors that are supposed to run. We are active. We want them to be active. And that's probably not a very good approach for dogs with osteoarthritis. When animals are painful and they have a decreased function with regards to the joints, it's very simple to fall back and to say, it hurts, I don't move anymore. And we have this visual circle. And it's, similar to people, animals will put on weight. And we know that putting on weight is unfortunately a bad thing. I love to eat myself. But we know that we can see significant clinical improvement, similar to the effect that we may see if we medicate with NSAIDs, if we optimize body weight. If the animal loses up to 10% of body weight, there's a house number that we improve our peak vertical force if we do objective gait analysis. By a similar, amount as what we would see with the use of NSAIDs. So just by avoiding a sedentary lifestyle, we can reduce our clinical symptoms. We can optimize our body weight. And as we know from the literature, also from the veterinary side, we increase the lifespan. But it's not just important to increase the lifespan. The WHO says we have added years to life. Now we have to fill these years also with joy. So it's important to have quality of life at the same time. And By avoiding a sedentary lifestyle and being active, our pets can also participate in family life. And in this way, we have the owner is happier and the animal too. So our goal is that we reach an optimal body conditioning score from 4 to 9 to 5 to 9. So there are a few things to consider. Many of our osteoarthritis patients are older, not all of them, but our prevalence increases with age. It's very important that the activity should not exacerbate the osteoarthritis symptoms. So it's important that we work with our patients every day. As I said, being a weekend warrior is not a good thing. We should walk with our pets multiple times per day, but it's better to do shorter walks. And we want to maybe not play with a frisbee and a ball. We want to do something with a low impact, like a leisurely leash walk out in the forest. We want to avoid, especially if the animals already have some clinical problems, we want to avoid high impact activities like jumping and running and this hard playing. If you look at the photos on the right side, you can easily guess which environment may be better in the beginning for a dog that has clinical symptoms with osteoarthritis. Let's assume this dog has elbow arthritis. Walking here on this stony riverside is probably not very pleasant. And as Jamie said, our balance may be to a certain degree compromised, and we also have a decreased muscle mass. The patient here on the right side is walking on a very, very soft surface in the forest, and can also work a little bit on balance. I come back to that in a moment, as we have some small little hindrances that you can use as a self-made little, trail. As a rule of thumb, anytime when we have a flare-up, we want to adapt the activities, and our caretakers at home, they have to understand that. When the symptoms are controlled again, we can working on increasing the duration of our works in a gradual way, and again on a regular basis every day. One thing, what may be something that we see more and more in the future are canine fitness monitors. They have become a bit more economic, and even if you do not own a canine athlete, it's kind of fun to have one of these fitness monitors. They are social media compatible. Not all of them, but some of them you can compare with your friends, you can compete. So this is a means where we may have the potential to improve owner compliance, and we can also check up on them. It's like the 10,000 steps that we as people want to do every day, and we look, have we done our 10,000 steps? We can provide our patients or patient owners with some goals in the same way. Another thing, what's important to keep an exercise diary. What do we do every day? Which kind of exercises do we do? And also, how does the pet respond to the exercise plan? Jamie has already talked about the problems that we see secondary to osteoarthritis. We have pain, we have a compromised joint range of motion. Some joints may be unstable. We have a deformity secondary to osteoarthritis, or maybe based on the primary cause of the osteoarthritis. Typically, our patients are stiff. Jamie has already touched on the decreased proprioception at the joint level, the muscle weakness, atrophy. So in this way, we have an impaired balance. And like with ourselves, I'm over 50 now. It's one of these things. We should keep this in mind and work on this with our pets too. You have already seen the stones on the slide before. When a pet is more advanced, a patient with osteoarthritis, it may be a good thing to use to look for a course outside when we go for walks, where that are a little bit irregular, where we go up and down, where we do sideways, where we have to navigate through nature, whether it's trees or little benches that we can slowly jump up. We can help the pet, but that's very important. We can also walk, work on balance at home when we're sitting in front of the TV. We can just easily, bring our pet out of balance by using our hands and let it respond to that. It's a very easy exercise to do, or we lift up one of the legs and the animal has to compensate for that. Different surfaces like walking over couch cushion or through sand, anything like that, is a good idea and easy to do. And we can be creative at home. You can work with boxes. You can try to involve your pet by making them seek for little, for little treats anywhere. There should be low calorie treats naturally. So there are many, many things that we can employ in our daily lives that do not cost us more time. They do not need to cost any big money. It's very important, and that's another thing what often gets lost in our busy clinical schedule, and owners with pets with osteoarthritis, they feel lost. We need to know how things are going, and we have to call back. And if it's not us, maybe it should be one of our co-workers. And we come back to that in a little bit.
So a helpful thing that we can do in management of osteoarthritis is ask the owners of these patients to do some specific home exercises. Now, while these may be less advanced than those that can be done by a professional physiotherapist or a clinician, the benefit of these is that although they make small gains, they can be done every day very easily in the home. So the exercises that we can start people doing are very simple. We can start with the balance and the weight shifting that Susanne was just talking about. So standing behind the animal when they're just standing still or eating, and you can just shift their weight side to side to encourage them to focus on their proprioception and get some muscle movement going on. Cavaletti rails are very useful too, and that is getting the animal to step over poles, and you can start with them on the ground and then raise them higher and higher over time. And what that is encouraging the animal to do, again, is focus on their proprioception, but also to lift their feet higher, to stop them dragging and scuffing. This improves the flexion of their joints, but also stops trauma to the toes that you might get with reduced proprioception. You can do these at home by using broom handles or by purchasing things on the internet. And you can make little assault courses for weaving in and out to increase flexibility of the animal. Passive range of motion is really useful. So passive range of motion is when you yourself or the client are putting the animal's joints through a range of motion. So for example, flexing or extending the limb. And this is different to active range of motion where they're exercising themselves. So what you're doing often is to ask the owner to put the limb through a bicycle movement. And this will allow increased pliability of tissues and muscle, the same as when we stretch before we exercise. And it encourages good range of motion. And over time, this will increase the range of motion of the patient in those joints that are affected. Treadmill walking can be done at home. Obviously, we need to be careful that it's done safely. Using inclines, slopes is useful as well. Animal going down a slope will take more weight on the forelimbs, obviously, and less on the rear limbs and vice versa. So if we're wanting to take weight off painful limbs, we can, for example, off forelimbs that are painful, we can make an animal walk uphill. For an animal that we want to increase muscle mass, we could also make them walk uphill if we want to increase muscle mass on the hind legs. And sit to stand exercises are very good. You can ask a dog to sit, stand up, sit and stand up, and this is equivalent to doing squats for a human. So this is very good for encouraging good flexion and extension of, for example, the hips, and to build muscle there. For animals who have more painful hips, you can make them sit and stand from a cushion or from a raised surface, so it's not such a harsh exercise. Massage can be demonstrated too. This allows good circulation. It's pleasant for the animal. The owners like doing it, and it can help with a little bit of analgesia. But something that is very useful is thermotherapy and cryotherapy, so heat packs and cold packs. So use of thermotherapy, heat packs, causes vasodilation, and this reduces muscle spasm. So muscle spasm can be a spinal reflex where discomfort around the joints can cause a spinal impulse to tense the muscles, and this spasm is also painful. So it is also increases compliance of the joint tissues, so it helps with range of motion, and it can give some pain reduction by interfering with nociception at the spinal level, in a similar way to how animals can override osteoarthritic pain through excitement and adrenaline. Like if they see a squirrel, they can suddenly run better. So heat packs will not penetrate as deeply as something like laser therapy. However, instead of costing £10,000 or euros, you can get a heat pack for £2 or £3. And this is something that can be done easily at home. Often clients will have this equipment at home. So that is a major benefit. So like with the less advanced exercises we were talking to just a minute ago, although not very advanced, it's something that can be done regular. And this feeds into our goal of treating osteoarthritis in a multimodal fashion. It's small gains of multiple different techniques. Cryotherapy is using cold packs. So while we might use a heat pack to warm an animal up and down before exercise or at the beginning and end of each day, we can use cryotherapy, is especially useful in acute inflammation. We wouldn't want to use a heat pack in acute inflammation. So before and after normal exercise, we can use heat therapy. Cryotherapy can be used if an animal seems to have hurt themselves, if they have a painful joint that they have aggravated during exercise. Cold gives vasoconstriction, so it can reduce inflammation. It also gives pain control by temporarily numbing the nerves, so you get kind of a cryoneuroanalgesia. So this is very useful in animals that have hurt themselves. And again, it's something that can be done very quickly and easily using an ice pack or even frozen peas wrapped in a towel. You don't want to have it directly on the skin of the animal. And it gives slightly longer effects than heat. Managing specific exercises needs to be done initially under direction, so people know exactly what they're doing. In severe cases or very geriatric animals, or animals that are painful and do not tolerate this kind of thing, we do have to take care. We do not want this to turn into a wrestling match with an upset animal who is in pain, and we certainly don't want anyone getting bitten. But you want to do this gently. You don't want to take an animal from 0 to 100 in terms of exercise. So we don't take animals straight out of their beds and make them run up and down. So using gentle exercise and increasing the amount of exercise gradually will help. We don't want aggressive exercise from home. So animals, for example, with elbow arthritis often need to stop bull chasing, or at least swim for the bull rather than run. And we don't want to do anything too complicated. Also, we have to take into account the climate. We all know that orthopedic and osteoarthritic pain tends to be worse in cold, damp conditions, such as I'm in Northampton. It's really not very pleasant. So we need to be aware that if we're going to take an animal out in those conditions, we do need to spend more time warming them up and down with exercise and with heat packs.
So we've come up to the top of the pyramid, the treatment by the physiotherapist. And let's start out, if we talk about physiotherapists, what do we really mean in this context? We really talk about professionally trained canine physiotherapists. We don't want to talk down to, about people that have done some continuing education, maybe 2 or 3 weekends. That's what we are not talking about. I think we can have a lot of benefits if the treatment is supervised and guided by a professionally trained canine physiotherapist. These professionally trained physiotherapists can certainly be supported by personnel that may not have as much knowledge. But the physiotherapist is able to diagnose specific disorders and deficits. They use their hands, they use their mind, they touch the animal, they find where, like the human physical therapists, where your muscles may be contracted, where you are painful, have problems, and they will really work with you on a treatment plan that's realistic for the patient, but also on the patient owner. It's very, very important that we involve our caretaker in the treatment plan, that they are very much involved and they can, also, are part of the process in deciding what's best for their pet, that they know best and they know the circumstances best. In this way, we can be successful. The physiotherapist will also modify the treatment plan continuously based on how the animal is doing. They will look on whether we really make any progress in the treatment. They will use subjective measurements, get the opinion of the owners, maybe using evidence-based, validated questionnaires. And they also have their own notes, and on a regular basis, we see, do we make a progress? And we are all a bit biased. We want to see the pet is getting better. And they have that in their hands. A wonderful thing is that a physiotherapist in general has very good hands. That's the most important, I just say, modality that we have. But on top of that, they can work with electrical stimulation. They may have aquatic therapy, therapeutic ultrasound, laser. And but I think the most important thing that a good physiotherapist has is they are able to communicate very, very well, and they are creative, and they are trying to get feedback from the clients, but also from us as the veterinarians that are kind of in the middle. It's also important for us that we get the feedback from the physiotherapist that sometimes falls down in the back because we are busy and we know the pet is getting somewhere physical therapy and we assume everything is going well. My favorite physical therapist, my background is also that I mainly, do surgery and I see these osteoarthritis pets. Is that, I get the feedback. Yeah, they will tell me, they give me a call, Susanne, you absolutely have to look at this pet, something's wrong. Or I get the hooray, it's all great, the clients are happy, the pet is happy, and we are making progress. Talking about these different physiotherapy modalities that we have for dogs with osteoarthritis, there's a lot that is utilized, but not everything, we may be still missing some studies that really show evidence that it makes a difference. One of these things is laser. There are a few good studies on the human side in patients with osteoarthritis, but it makes a difference, but it depends a lot on the laser. On the veterinary side, there was just a study from the United States showing that we use laser a lot in practice, but we really don't have any good studies yet about how well it really works on osteoarthritis itself. Where we know that it is useful is by treating trigger points, points that are painful on joints or in muscles. And we use it for pain management, similar to TENS, that's transcutaneous electrical nerve stimulation, that you see in the picture below. That's something what the owner can also do at home with a little unit. There was multiple interesting studies about the benefits of extracorporeal shockwave therapy in dogs with end-stage osteoarthritis. One study from Tennessee about elbow osteoarthritis, where in these dogs that have end-stage osteoarthritis and they would be up for joint replacement, where we see that they walk better and they have an improved quality of life. We've also seen some new study on low magnetic resonance therapy in low magnetic fields. And there's a nice study from Vienna showing that we have objectively improved lameness scores in these dogs. Aquatic exercise, just thinking about it logically, is great. As we know, many of these osteoarthritic animals, they are painful, and they don't want to put a lot of weight on their joints due to the buoyancy. We can reduce the impact on the diseased joints. We can reduce the stress on the joints. And if the animal is still overweight, it may be a good way to work out. Depending on the water level, we also have the option to work on the range of motion, meaning on extension or inflection, depending on which problem we have in these joints.
Thanks, Susanne. So here are some practical recommendations that we feel may contribute to the way you manage these things in your clinic. So in practice, and we know you're all busy, it's really important that this side of arthritis management is run as a team approach. This is not just a clinician dictating what's going to happen. We often don't see these animals as often as we would like, and making statements and making judgments that will last over a year are clearly not effective. We need to communicate very well, as Susanne was saying, with not only the owner of the patient and how they feel the animal is doing themselves day to day, how they're getting on with their environment, how the exercises are helping. We need to discuss with the physiotherapist, because there's no point in them doing lots of good work if we don't hear about it and we don't factor that into our treatment. We know that osteoarthritis is a disease that progresses, and we're hoping that the treatments that we're starting will make improvements. So we need to be on top of this, and we need to be aware of how this disease is progressing and how improvements are occurring. So by communicating, that's how we run this. Feel yourself as more of the captain of the team rather than the most important person in the room. So this team does involve us. Often our nurses are very good at running clinics. They often have a lot more time to discuss things in depth than we do with the owner due to the time limitations we have in practice. And then our professional colleagues, physiotherapists, hydrotherapists, etc. So this means that we can be more objective with how things are changing over time. We can get movement scores, we can get muscle measurements, and allows us to build up a more accurate picture of how the animal is progressing, how the disease is changing, and how there's an impact of what we're doing. Better communication also involves the owner a lot more. In the old days, they would turn up twice a year to the clinic when we would examine the animal and say, here are the tablets for the next 6 months. They don't feel involved with that. It's really important that we bond these animals both to the process and to their pets. So things like exercises at home are very useful, and asking the client to pay attention to these things means they can give you more detailed information when they do come to the clinic. Again, this is a multimodal operation that we're doing here. We're talking not just about different types of exercise, we're talking about physiotherapy, and also we're talking about multimodal pharmaceutical interventions and surgery. It's definitely a condition where we're making many, many marginal gains. And that is the important way to run this. So doing small things every day is of vital importance in management. And that is where home exercise and physiotherapy come in very importantly. And this will then allow an improvement of the pharmaceutical regime that you're asking them to use. It'll basically make what you're doing better. But the main thing, as Susanne was saying, is communication. We need to all be aware of what's going on in the big picture. So in practice, we know you're all struggling for time, but it is important that enough time is given to this. That means making ourselves available for questions and for examinations, making the examinations long enough, making sure that we're not trying to fit osteoarthritis into a small amount of time. So often, being able to fit this in at the same time in a consultation with an annual vaccination is just not realistic. And it's worth offering to the client, do you want another appointment to discuss this? And often, even if there is extra expense, this is what the clients will want. Nurse consultations are also very useful because it does give time for the owner to open up about what they're seeing with their pet. Being objective is hugely important. There's no point in notes in clinical records that say doing okay or worse than last year. We need to be as objective as we can so that we can remember when we next see the animal how things have changed. And also, if it's not us seeing them, our colleagues need to be available to judge. So clinical metrology, such as the load questionnaire, are very, very important and very useful. It allows us to write down a lot of information very succinctly and clearly so that people can work out from our notes how things are going and compare. We need to make contact with the people we're working with. So if we're asking the client to use a physiotherapist, for example, we need to speak to them when they give us referral forms to fill in. If there's a big box asking what's wrong with the animal and what we're expecting, writing osteoarthritis in itself is just not enough. We need to say which joint, how severe, what are we expecting? Are we expecting improvement in range of motion? Are we asking for them to build up muscle? And the more we talk, the more useful their impact will be, and the better the treatment overall will be. So a happier client and a happier pet. We need to demonstrate what we're asking. It is no good for someone just to describe an exercise like passive range of motion. You do need to show the owner exactly what they're doing because they will be nervous. They don't want to hurt their pet, and we don't want that to happen. So nurses and physiotherapists are very, very good at doing this. And also online resources, videos are very helpful. Environmental plans and exercise plans need to be put in place early. If you remember when Susanne was showing the pyramid, they were at the very base. And that is because until we start those and get body condition score correct, we're not going to get the kind of changes we want when we do the things higher up the scale, such as the physiotherapy or the pharmaceutical interventions that we've been talking about in separate videos. You need to engage the client. They need to be definitely part of this process, and they need to see how what they can do helps. They are very involved with the treatment and they are important, and they need to feel like that. And once they do, we get a better team outcome, and it's much more pleasant for them. They get very involved. We need to make sure that they understand exactly what we're asking of them and why, what the benefit is. We don't just say, use this heat pack twice a day. We explain to them what the heat pack is supposed to do, when they're supposed to use it, and why. So explaining to them, often from their own experience, we use this heat pack to warm up and down the joints before and after exercise. Then they understand exactly what they're trying to achieve and why they're trying to do it. So physical therapy often is forgotten, but it actually will often give the most cost-efficient changes with profound effects on the success of treatment. So although it is not maybe as exciting or usually as focused on as other modalities, it is extremely important in making cost-efficient and profound changes to the animal.
And it's often very, very simple things, as Jamie said, that we overlook. We're looking at the big things, the big picture, the medications, radiographs, but also the owners are not aware of that, and we have to raise the awareness.
Obesity control and avoidance of a sedentary lifestyle are vital. These animals, if they're inactive, they will progress. We'll enter that vicious cycle and the condition will get worse. We need to intervene to break that vicious cycle.
This physiotherapy or PT pyramid gives you a little guideline for optimal management of osteoarthritis, especially in a busy practice.
And remember that communication is key. This is a team event. We're not doing this in isolation. If we work together, we'll get a better outcome. Thank you for your attention.
Thank you very much. We are at the end and would be happy if we can answer any questions.